This week, we talked to DIHI's own Mike Revoir and Jamie Daniel about the newly released ResearchKit app, Autism and Beyond, along with Ricky Bloomfield. For more information on this or other DIHI activities, check out dihi.org. That's dihi.org. Now, on to the interview, moderated by DIHI's Kimberly McCrae.
So, Ricky, if you could do us the honor of introducing yourself and telling about who you are here at Duke University and who you are in relation to ResearchKit.
Sure. So I'm Ricky Bloomfield. I'm a physician in internal medicine pediatrics and the director of mobile technology strategy. And I had been working with a couple of projects with Apple for a little over a year, including Duke's integration with HealthKit, which is a technology that lets us let patients share their data with their physicians so that physicians can help take better care of them. And that's been an ongoing project. When ResearchKit was announced, we immediately saw that was an opportunity for the health system to jump in and to move the needle on research. And so we cast a wide net for potential projects that ResearchKit would apply to. Mm-hmm. I had actually been attending physician in pediatrics about a little over a year prior to that, and worked with a medical student by the name of Kathleen Campbell on her pediatric clerkship. And she had an interest in childhood behavioral health at the time, and she actually showed me this app that she was working on with her research team that took video of children to analyze the video, detect their emotions, to hopefully screen for autism. And I thought it was fantastic. She knew I had an interest in mobile health technologies, and so she wanted me to see it. And I didn't really have anything to offer at the time because it was amazing work already. And so I said, I'd love to hear how this goes. Please keep me informed, but I don't really have anything to add. But when ResearchKit was announced, it was clear that this was a contender for one of the projects we would work on. It already had a great team around it. They already had experience building an app. It was a very visual app, and it was also research that could benefit significantly from scaling out to children across the country and around the world. Okay. So I reached out to Kathleen and said, would you be interested? And the team said, oh my goodness, let's do this. And that's kind of how this project got involved with ResearchKit.
Okay, so that's a great beginning. So what exactly is ResearchKit?
So ResearchKit is a technology that was announced by Apple in March that is an open source framework that gives us some tools to create a research study in an app, in a single app. It includes the ability to consent a patient, or in other words, get their agreement that they would like to participate in a study, which typically involves meeting with the user individually, right, and explaining everything and then having them sign a piece of paper. Right. What ResearchKit allows us to do is give them this information, and they can do it all on their own. And this is all approved by our IRB to do. So it's really groundbreaking to be able to do that. And then also ResearchKit gives us the ability to standardize basic questionnaires in a really user-friendly way. Mm-hmm. And then it also gives us the ability to use what Apple calls active tasks, or different things you can do using the technologies that are in the phone, whether it's the camera or the accelerometer or the touch screen, that can give us novel ways to test various things for users. Okay. That's basically what ResearchKit allows us to do.
Okay. So can you talk a little bit about the team here at DIHI and the value that was generated from their expertise and the roles that they played?
Sure. So Mike Revoir and Jamie Daniel here, we're actually looking to hire some great mobile developers, and we offered them a position to work here just shortly before ResearchKit was announced. Mm-hmm. It was around that same time. And so the timing couldn't be better, because both Jamie and Mike have experience doing mobile technology for both iOS as well as Android, mm-hmm, and they have experience doing it for research studies. And so they actually jumped in and started getting involved, I think, even before their first day of work, technically. We didn't ask them to do that. I think they were so excited. And I'll let them talk about that as well to get going with this project. So it was just a perfect fit from the beginning, to be able to have them jump in. And initially, we thought we were going to have a really tight deadline. We started work on this basically in April when the code was released, April 24th, I believe, and wanted to get something out by June, which was Apple's Worldwide Developer Conference. And so everyone was heads down working like crazy to begin with, which fortunately we ended up having a little more time than that. But both Mike and Jamie just jumped in with both feet, and I don't think we could keep them from working on this if we tried. It was such an exciting project.
Okay. So what is the value that DIHI as a team or as a group brings to these types of innovative initiatives?
So DIHI has a unique position in the health system in that it is separate from all the various organizations here at Duke, and I think that brings with it the ability to have insight into what all these organizations are doing and how those organizations can best work together. And so I think that's some of the greatest value that DIHI brings, is seeing what the strengths are of these various groups and helping connect the dots. And so I think that was brought to bear here as well, because this project required the involvement and participation of so many groups. And then the addition of developers to DIHI with Mike and Jamie has only increased DIHI's ability to not just bring people together, but actually contribute directly to that work in a meaningful way. And the app that you see if you download Autism and Beyond would not exist without the work of Mike and Jamie, who, along with working with some developers on the study team, made this app come to life.
Great. Okay, so it sounds like DIHI's involvement was beyond just having Mike and Jamie as developers. There was more of a team involvement than just that. Can you talk a little bit about that? Was there anything else that DIHI did? Any other participation?
DIHI also contributed financially to the project, and one of the things that we were able to do is we had the opportunity to send members of the team, Mike and Jamie, as well as two of our developers, Stephen Espinosa and Chet Corey. Stephen works with Guillermo and his team, and Chet works with the Office of Research Informatics within DHTS in the School of Medicine. And to send them to Apple's headquarters in Cupertino to work directly with Apple's team to get feedback on the app and to improve it and really make it the best it can be. And I think that was a unique experience. I'll let them talk about it more because they were there. I wasn't there. But I think that was invaluable. And DIHI funded that visit for Mike and Jamie, which was considerable.
Okay. All right. So just to kind of wrap up questions with you, how has DIHI supported you personally in, this project, other projects? How has DIHI been a support to you?
Sure. So I've been involved in various things here at Duke, and my personal goal has been to help bring technologies to Duke that help everyone be more successful in their role. And that aligns perfectly with what DIHI is doing. And so DIHI has been fantastic in helping to spread the word about this work that's going on. And again, connect those dots with people who have a particular project that they need a certain technology to make that work, and help let them know, look, there's technology that's being developed, that's being supported, and this can help you achieve your goal as a researcher, as an innovator. And DIHI has a window into those groups and individuals in order to make those connections.
Okay, great. So we're now talking to two of our wonderful developers here at DIHI. Can you please introduce yourself, Jamie?
My name is Jamie Daniel. I'm an Innovation Solutions Architect at DIHI, or Duke Institute for Health Innovation.
Okay, and that's a lot of big words. Can you tell us what is your actual role with DIHI?
So at DIHI, it's more than just a solutions architect and as a developer. So we actually foster relationships We go out and we actually work in other people's offices and help kind of put things together for them. So it's more of a developer, project manager, product manager. So all those traditional things are kind of rolled up into what we do. And that's why it's an innovation solutions architect, because we do things that nobody else has done.
Great. That's a great description. So this app, this autism app, can you talk a little bit about your involvement, your excitement around it, your interest in it?
So in the beginning, when we were first offered the positions, we knew that Apple was releasing ResearchKit, which Mike and I had already for like 2 years before that at our former position already done an informed consent on a tablet. We'd already done things that nobody had done in the industry yet successfully and actually used them in practice. So we were excited to see that Apple, one of the big companies, were actually putting effort behind it, and it was going to be open source. So when they contacted us and said, hey, we got this project that we want you guys to start looking at when you first get here, Mike and I were like, yeah, we can start doing that now, because we already had experience with that kind of genre of development. So we jumped in and started talking to the group and attending some meetings and kind of jumped in, I guess, feet first, and really started taking a hold of what this could be, and brought whatever skills we had to the table. So
okay. And if you could introduce yourself, Mike?
Sure. I'm Mike Revoir, and I'm a solutions architect at DIHI as well.
Okay, and in your definition of that, could you explain what your role is with DIHI?
I completely agree with Jamie. One of the reasons that I really wanted to come to work for DIHI was the ability to work across organizations, both within Duke and outside of Duke. And that's something that I think that DIHI is in many ways uniquely able to do. And it's a great thing that we're able to go out and not just kind of talk with people about the individual, types of research that they're wanting to do and how can we apply technology to it. But it's really partnering with, how can we help with patient care? What can we do to either make someone's life a little bit easier when their loved one just had surgery, or they've come out of surgery and now they don't necessarily know what's going on. What can we do to really help stuff both in the research side of things and also in the clinic side?
Okay.
It's really kind of cool and interesting.
So with this app, what was your initial interest in being involved with this app and the development of it?
Sure. One of the big things for me is I have a son who has pediatrics. Now, I have a son who has infantile scoliosis, which means that he was diagnosed really, really, really super young. I think it was less than 2 years old.
Okay.
that he had scoliosis. So it was a really wicked curve. And the ability for us to get in and get, I'll say, services,
Mm-hmm.
and to know that this is what's coming, and these are the types of things that you're going to need to look out for at that young age, was really super helpful. So I was fortunate enough to get hooked up with docs that knew other people in the community that I could interface with and learn things that were going on. And with something like autism, where diagnosis typically happens so late, when
Right.
it can be diagnosed potentially so early,
Mm-hmm.
the possibility that we could help to develop screening tools is huge. Because if we're able to say through this particular Autism and Beyond research study that we can somehow figure out how to screen individuals, so that the same way that you go in and get a vision test, the same way that you can get a hearing test, and you could somehow say, what, your child may be at risk for some type of early childhood learning disorder or something
Mm-hmm.
along those lines. Again, it's not being diagnosed. That takes a professional.
Right.
But just to be able to be screened in a way that it can happen, one, by the parent without by the parent and the physician's office, wherever it happens, to be able to get people in so that they have services available to them, so that they don't feel like that they're alone and they don't understand what's going on,
Right.
is really super important to me.
Wow, that brings in a completely different perspective on something that can appear to be very technical, but I appreciate your insight on that. So what was the actual process in working on this app? I'll just let both of you jump in as you feel the need to.
So working on the app was really interesting because we did have a very short, tight timeline.
Mm-hmm.
So there was lots of late evenings, late nights, going over code that was brand new, and there was changes happening to ResearchKit as we were, developing with it. I mean, it was a moving target, yeah. So working on it was extremely exciting. So first we had to decide how we were going to approach the application from the specifics. We also had to tear apart some of the free code and stuff that Apple had released. Mm-hmm. So we were not only researching and reviewing and testing and retesting, we were also having to design and put together pieces and components of our application.
It's a lot of moving parts.
So there was dozens of moving parts. Yeah. And then on top of that, not just from a technical standpoint as to how to go and program it and code it, but there was also so many groups that were involved. There was the negotiations, the alliance making, there was the meetings, there was the side discussions, there was all these things that had to be coordinated, so that way we knew that this person was doing this piece on this date, and here's what they needed, and here's the resources that somebody else could provide that made this happen for them. And it was really like playing this big comptroller kind of position. So it was extremely interesting, and the things that we were able to do in such a short amount of time and bring those groups together was huge, while we also had the technical challenges. So
yeah, one of the things that I'm really proud of is if you look at, I'll say on the research side, there's, I don't know how many, half dozen different institutions that are involved in a fairly significant way, from the psychiatry and behavioral folks to the engineering side and all those types of things. But also what we did is that we actually went ahead and we got other groups involved in the actual development. So Jamie and I went and talked to the folks over at ORI, the Office of Research Informatics. Mm-hmm. And they had been doing a lot of web development on applications, but they hadn't been doing any mobile development, but they wanted to get into the space. Mm-hmm. So Jamie was able to go over and do a few, courses for them, if you will. We were available for them at any time to basically say, hey, we're having this problem as we're trying to, build this app that we're working on here, and also with other apps that they were working on. But because of that ability for DIHI to bridge those types of relationships, that now, I think if you talk to some of the folks in ORI, they'd say, you know what, because of this project, because of what DIHI was able to do, we now have a new way of conducting business. We now have a new product offering and being able to do mobile application development. So not only was it working on the individual tech for this particular app, which in many ways is kind of cool, but the ability to kind of create those alliances and to be able to grow other development teams was really amazing. Wow. You look at the tech and it's really, it's fun. So if you use the app, one of the things that you can do is you can kind of swipe through and you can see what it's going to be like for you and your child. So there's a picture of your face, and we're using the camera on the phone, and we're using a library from Intraface to basically map out where your eyebrows are, your eyes, your nose, and your lips. And then based on that, their library detects the expression that you have. Oh, wow. So based upon the expression that the child provides, right? So their reaction to a stimulus video, so whether it's someone clapping or bubbles on the screen, or the little bunny rabbit that kind of bounces around and beep 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 beeps. That's my favorite video. Is the bunny rabbit one. I always love the little bouncing bunny rabbit. To be able to combine those two together so that we can do the research on what is, I'll say, typical, right? Normal's a bad word because nothing is normal, right? But what's typical, and then leveraging that and seeing how we can integrate it with ResearchKit, how we can create something that can be reused, so that every time we go out and do one of these ResearchKit apps where we're trying to collect information from basically just the public on their own devices, which is really awesome, to be able to reuse that logic so that we're not constantly rebuilding it over and over and over it's a really important thing that we were able to create, so that it's not, okay, here's another custom application whenever we want to do our next research project. In many ways, it's let's pick up the code that we had and then just tweak it in a few ways, and now we're able to do research again for whatever other thing we want to look into.
Yeah, see, that's one of the things I think is really I think has been overlooked or lost in this huge effort. So let me come back up and look at it for a second. When we started, Mike and I had been working together for almost a decade. So we already knew what each other's skill sets were. We already knew how each other worked. But we didn't know a lot of the other teams. We sort of knew some of them in passing or had worked with one of them before in the past. So when we started to work on this and had the technology together, two of us from DIHI functioned as not only managers and project managers and designers and programmers and developers and testers, but also trainers. And, there's a whole plethora of things that we've done. And then in the middle of that, developing an application and learning about the mental health space for, so we also had to learn a whole new research phase. It wasn't just drugs and therapies. This is actually having to evaluate something that we, had no experience with. So the level of effort that went into this was just huge. And, working with the amount of skilled people that I did on this project was humbling. There were the people that I get to work with on a daily basis. I don't think anybody else could say this is not the coolest job in the world.
Yeah. And another thing I'll point out for this particular app, Ricky mentioned the fact that we had initially, ResearchKit was released August 24th, and we were shooting to launch. Oh, so April 24th. Thank you. August is the other date that goes, right? So April 24th. So we were shooting for a beginning of June app launch.
Okay.
So Jamie and I started beginning of April.
Yeah.
We put together a prototype of what could this app be in a couple weeks. Right. So putting a prototype together is fairly easy. Making it a product is what's difficult. So we ran, full tilt, full stream, everyone's all in to meet, this June deadline. And when you get halfway through May, it's okay. Well, we're not going to do this June deadline now. Now we're going to do a. I think it was like October. I think it was the end of August. Yeah. Is what we were shooting for.
Yep. So
we're like, okay, we've got a little bit of breathing room. So life goes slightly back to normal, and when that happens, so that was a cool thing.
3 days.
So we built one app. We go and we start working on, in effect, all these extra new things that are really going to make the app a much more pleasurable experience. They're really starting to carry it out. And then being fortunate enough to go out to Apple and meet with them, which was just amazing. In effect, we built a brand new application while we were out there. So while we were out there, sprinting with Apple, I think we went through 3 user interface designs in 4 days, which is a lot of work, but it was really cool working around the clock with the guys.
There were times that I would come back and go to sleep, take a nap, and then about the time these guys were kind of stopping, I would wake up at like 1:30 a.m. and work until
working in shifts
3:34.
Wow.
And it was because we would wait for somebody to finish one piece, and then I would go jump on another one, and then they would be like, "Oh, well, I'm going to test what you did." And this, it was more. I think the days, I lost track of the days. All I remember is that we all met downstairs for what was breakfast. I'm not sure what time of day it was, but think about that initial development model. There was like 6 weeks, and we actually trained new developers in a totally different thing inside of 3 weeks, because they were actually helping develop this for the June deadline, and we ramped them up there were times that Mike and I were both doing tutorials for some of the developers and actually explaining how things needed to work at 2 a.m. And then we would be back here at 9 a.m. or we'd be back online at 9 a.m. And it was around the clock. I don't think there was a time that you couldn't text one of us and somebody would be awake.
Wow.
But that's the kind of effort that we wanted to put behind this. Think about how important this app is that we were creating, and how important what Apple was doing to position ResearchKit in such a way that it enabled tons of researchers who may not have a large tech department the ability to have something that can be utilized with their devices to get them way ahead of the curve very quickly. Like Mike was saying, the average age of detection of autism is like 5.4 years old. That's after they start school.
Right.
And for us to be involved in something, for me personally, I have a relative that has a child that has autism. So for us to see how they struggled all the way until school and then they got diagnosed, for me to see that they could do this between 12 and 18 months, So, I think everybody who's involved in this does it because it's personal, does it because they love what they do. But, to be able to see, what's next. I mean, that's really the cool thing about doing innovation. What's next? Or what can we help you do this next?
And one of the exciting things I think about the project as well, as Mike and Jamie touched on, is the impact and the scope of this project. We are excited to roll this out in the United States. But there are also plans very soon to make this app available in China and South Africa. And in order to do that, that required additional partnerships with specific universities in each one of those countries, so that we could get this app IRB approved in those countries, which a tremendous amount of work that the team put in to make that possible. But just to put it into perspective, so in North Carolina alone, there are 70 counties out of our 100 counties that don't have a childhood mental health provider.
Right.
Extrapolating that, if you look at Africa, so we're working with the university in Cape Town, South Africa, Petrus de Vries, who's basically leads the Center of Autism that covers the entire continent. And the entire continent of Africa has about 1 billion people. Half of those are children, 500 million. So for those 500 million kids, there are 50 childhood mental health providers that could potentially perform a full autism diagnosis if you were to need it. That's 1 for every 10 million children. That problem is never going to be fixed by training more people. It's just not going to happen. So in order to meet that need and to help all of these individuals, when it comes down to it, it's about the one child and helping them be more successful in school and at home, etc. In order to do that, we're going to have to rely on technology, just like what this study is trying to do. And that excites me. I mean, that's really exciting to know that we've worked on something that could potentially have an impact to millions and millions of children the world over, once this technology is validated and the research is complete. And that's not even to mention the impact that this will have in China, in South America, and around the world. So I think this is really just getting started. And I think that's one of the most exciting things. The app launched yesterday, and we've already had. I was
going to ask, so the app launch, when did it happen? Can someone give the actual name of the app, and where can people find it? How can people access it?
Sure. So the name of the app is Autism and Beyond. And so if you search for either Duke in the App Store or search for Autism and Beyond, you'll find the app. Also, you can go to the website autismandbeyondapp.org to find more information about the team and about the app and to download it.
So it's really exciting to be part of such an innovative team of players, and this is just one of the many things that DIHI is doing. Stay tuned to find out what's next.